So viewers, you are welcome back again to Dr. ABC show. On this show, we try to educate listeners and break down complex things, demystify the mysteries behind medicine, and break things down for the understanding of the ordinary person. We have been looking at the immune response to COVID-19. The body has got immune system that respond, just like the soldiers that respond to any attack from foreigners. It's the same thing that the body has. So in the part one, the previous episode, we actually look at the generalized immune system, where we have the innate and the adaptive immune system. So we had a specialist who actually explained the difference between the innate and the adaptive, and actually explained the mechanism that are involved when there is any viral infection. In this episode, what we are going to look at is to look at what do we call immunosuppressors, that things that bring down immunity. Because in the first episode, he said that if your body immune system is strong, you are able to fight the virus yourself, that is the body. So we want to study the things that can bring down our immunity so that we avoid them. Then also we pick and look at how can we boost our immune system. A lot of people are talking about immune boosters. What is an immune booster, and how can we boost our immune system? What do we do to do that? So it is my pleasure now to invite a knowledgeable person, a person who has studied immunology and have his doctorate in immunology, to explain that to us this day. It's my pleasure to invite Dr. Mubarak Abdul Rahman to actually explain to us what is immune suppressors.
Thank you very much for inviting me to this show. So from our earlier episode, we explained what immunity is, and we look at the two categories, broad categories of the immune system. We talked about the innate and the adaptive. So we would also like to look at the immunosuppression in reference to some of these two categories. So, but broadly, immunodeficiency can be classified into two. We have the primary and the secondary immunodeficiency. So the primary immunodeficiency, in a layman's term, is the one that you are born with. So naturally, you are born with
immunodeficiency.
So you are born deficient in some aspect of the immune system, or it's as a result of failure to develop some organ or some genetic predisposition. But primary immunodeficiencies are rare conditions. They are rare, very rare. So the secondary immunodeficiency conditions, they are more common. Now with the secondary immunodeficiency conditions, these are immunodeficiency conditions that is secondary to something. So it's secondary to something. So you are doing something that suppresses your immune system. You are taking a drug that is suppressing your immune system. So you are immunodeficient secondary to this drug.
Something is causing that one. You were not born with it.
Good. So you are not having good meal. You are skipping your breakfast. And your
breakfast.
Yes, very relevant. Your immune system, your immune system is suppressed. So
breakfast is very important.
Very, very important, because you need that energy to take you
to start the day.
Exactly. Supper, you are supposed to take something.
But unfortunately, we all ban our hope on supper.
That is the problem.
So we should switch.
You should switch. So for instance, even in medical school, I used to advise my students, some of them, you see them with a bottle of Cokes, and all these are immunosuppressants. They don't eat well. And other stuff, you see them with bottles of drinks.
So you are not saying Coke is immunosuppressant?
No, but the drinks they are taking, they are not
food.
They are not taking a balanced diet, they are not taking proper food, they are not eating well. So you can be immunodeficient secondary to malnutrition. So all these are secondary.
So you see a tertiary education student having malnutrition.
Yes, secondary. So that is why you see when the pressure of the academic pressure start coming, you see them falling ill because their immune system is down. The pressure in itself is immunosuppressant, and you see them manifesting with opportunistic infection, which on normal day they wouldn't manifest with that infection. So the immunodeficiency is secondary to some of those pressure.
Thank you. So I think you are picking the immunosuppressants, and you are looking at diet. So let's look at diet in totality. You talk about skipping your breakfast. So some of us who would like to eat midday, because we say we have a pressure in the morning. When I eat in the morning, I feel sleepy. So I want to eat in the afternoon. It's not a good thing, a good practice.
From the dietitians, they've made us aware that those who skip breakfast are likely to eat a lot
in the afternoon
or in the evening.
Yes.
And as much as we encourage you to eat, we are not saying you should overeat, or we are also encouraging you to balance your diet, because the vitamins and all the nutrients is required for appropriate immune response. So the bone marrow also need all these to produce the cells, and the cells themselves need some of this energy to undergo the clonal expansion. So where you are overloading yourself with food, you are accumulating fat. At the point, you are accumulating fats. And once you start accumulating fat, your immune system will go down, because the fat will prevent the signaling molecules from getting to the cells to be activated.
So you are saying that if your body is having excessive fat, it is also an immunosuppressive factor.
Exactly.
Oh, because it's going to prevent the signaling effects. So obesity is also
a risk factor for immunodeficiency.
Oh, okay. So we should reduce weight.
Very
in
important.
This time of COVID. We should take our breakfast regularly. Even if you don't have money, you have to take something.
So that will regulate your diet as you go on.
Yeah, so that you don't bang all your hope on the afternoon or the evening.
Meal.
So some do 0-0 and evening they just
hit it.
Okay, it's not the best.
It's not the best. That's why exercise is an immune booster.
Okay. So even the Islamic fasting that is going on now, it is not a risk factor.
It's not
for
a
what
risk
you are
factor
saying.
For immune.
Because you have to take something in the morning.
In the morning.
Okay.
So some scientists came out to say that the Ramadan fasting is having an effect on the immune system. But if you look at all scientific research, none of them was able to come out with this immunosuppressive effect of Ramadan fasting. And if we want to explain using mechanism, it makes sense, because you eat in the early hours of the morning and you just fast for only about 13 to 14 hours, after which you replace all those lost energy. Okay, and if you take averagely, depending on your activity, when you eat carbohydrates, it takes averagely between 6 to 12 hours before you fully digest this. So there's no way Ramadan fasting can actually impact your immune system, but that is if you follow the right protocol.
So the early morning food will be there, as it's being digested. You are preparing for the
evening to replace it.
Yeah.
So in the evening,
the place is actually not empty as it were.
Exactly.
It is just that food is not entering your mouth.
Exactly. Water is not going.
Yes.
So depending on your activity will define what you should eat at dawn. Okay. Right. So basically, those are some of the things that can lead to immunodeficiency. But then we can look at some common things that we also do that can predispose us to secondary immunodeficiency. I remember when the COVID came, and there is this education that we should use alcohol-based sanitizer. There was this misinformation among the locals that if alcohol-based sanitizer can actually kill the virus, then let's drink it, and then that will prevent us from getting the virus. So to clear this perception is actually not true when you drink it. Rather, drinking alcohol suppresses your immune system.
Yes.
When you drink alcohol, you put more pressure on your liver. If we have time, we'll go into the liver immunology. You know the importance of liver when it comes to immune system. So when it comes to all the molecules that aid in the immune system, most of them are produced by the hepatocyte. So once you put pressure,
the liver cells.
Exactly. So when you put pressure on your liver, you can't produce all these molecules. So eventually you become immunodeficient.
Oh, okay.
So that is why if you look at those who take alcohol, excessive alcohol,
yeah,
you realize that they are naturally weak and are more susceptible to infection.
Okay, so the alcoholics, please just be cautious about this, because in this COVID pandemic, if you want to survive, you have to stay away from binging huge amount of alcohol. I think it's a very useful point for us to have a break and go for a commercial break. So, Doc, I beg that you hold your peace, and when we come back, we are going to explain other factors too. So, viewers, let's go for a commercial break, and when we come back, we will continue from where we left off.
Green Hill Stroke Rehabilitation Center is a rehab center located in Sakaman in Accra, Ghana. It is the first accredited stroke rehabilitation facility established in Ghana. Green Hill Stroke Rehabilitation Center seeks to provide a high-quality rehabilitation service to stroke survivors who are out of the intensive care and requiring rehabilitation to restore functional performance of activities of daily living. The rehabilitation team includes attending physician, neurologist, rehabilitation nurse, 24-hour service, physiotherapist, occupational therapist, speech and language therapist, dietitian, clinical psychologist. Aside the stroke treatment, we treat other diseases at the Green Hills Medical Center. Call Green Hills Stroke Rehabilitation Center now on 055 2505 108 or 030 3974 818.
Yeah, so viewers, you are welcome back to Dr. ABC's show. We've been having a very hearty discussion about immune response to COVID-19, and I'm here talking to a knowledgeable person, Dr. Mubarak, who has studied immunology to the doctorate level, and he's actually trying to explain to us things that suppress our immune system. So let's go back to the discussion. He's spoken about diet, our BMI, that is whether you are obese or not. If you're obese, you have a lot of fat in you and it immunosuppresses you. Skipping breakfast is also a risk factor. So, Doc, what else?
Yeah, as I was explaining, that you can have immunodeficiency secondary to drug intake.
Okay.
So those who abuse drugs, could be in any form.
So abuse of drug means that you are taking a drug that has not been prescribed to you, or you are taking more than the level of prescription.
Exactly.
Good.
So those who are analgesics like this are also immunosuppressants.
So analgesics are the painkillers.
Painkillers.
Okay.
Because pain is actually part of an immune response.
Okay.
It's part of an immune response.
Okay.
So if because the
whole. So I always say that pain is good.
Yes.
Because it makes you go to the hospital.
So it's part of an immune response.
Yes. Okay.
Just like the fever that we need to control because your internal organ. When the pain becomes excessive as a result of the cytokines you are producing, those cytokines need to be suppressed so that it will ease the pain.
Okay.
But actually, the pain cytokine is kind of inflammatory response to deal with the pathogen.
Yeah.
So some people, for some reason, they become addicted to painkillers.
Also, painkiller actually suppresses the cytokines that is produced.
Because most of the painkillers target either the pain cytokine.
So then these painkillers are really creating problems, kidney problems, everything. So painkillers are really an issue.
If it's not prescribed, it's not advisable for you to use. And those who smoke, these marijuana and
weed smokers,
heroin and that stuff can also predispose you to immunosuppression. So these are some factors that can lead to immunosuppression.
So talk about the drug, we talk about the diet. So let's look at the psychological.
Psychologically, when it comes to strong immunosuppressor, then it's coming from your psychological domain.
Okay.
Because the hormone, the stress hormones are strong immunosuppressants.
Okay.
So when you are psychologically upright, then your immune system would be good irrespective of your underlying condition.
Okay.
But the moment you have fear, anxiety, you are panicking, you produce a lot of stress hormone. So let's say, for instance, if somebody is said to have COVID infection, when somebody says to have the viral infection, then this person harbored the fear and the panic. It's actually the fear and the panic that will lead to immunosuppression, and that will give room for the virus to destroy the person.
Oh, so the fear actually suppresses the immune system. And when the virus comes, the immune system may not be able to fight.
You are physiologists. You know how fear leads to production of cortisol.
Cortisol, yeah.
And cortisol is a good immunosuppressant.
Oh, okay.
It inhibits the proliferation of the cells.
Oh, okay.
So the fear and the panic, for instance, that people are creating and kind of running away from those who recovered from COVID, and this is not good because having COVID infection is not a death warrant. It doesn't mean that you are going to die. No.
Okay.
It's just telling that you are carrying something in you which is not part of you, but you need to get rid of it. Okay. So you don't need to be afraid. But actually the virus itself does not damage us. It's our own immune response that will damage us. Okay. So when you have that fear and panic, it suppresses the immune system. That's when the virus will take over and gets you destroyed.
Oh, okay. So if I get it clearly, it's like enemies entering the country and someone capturing the soldiers for the enemies to attack us.
Exactly.
But not the enemy themselves attacking the soldiers.
Exactly.
Okay, so the virus itself does not attack the immune system. Does it attack the immune system?
Well, it depends. As I said, with the COVID, we don't know much about it yet. But when it is something like the HIV, that virus specifically targets CD4 expressing cells. Okay. And we have macrophages, we have dendritic cells, we have CD4 T cell, and these are key to immune response. So in that case, the virus will enter into this cell. When they enter into this cell, your own immune system will see them as infected cells and destroy them.
Oh, okay.
So that makes you immunodeficient.
Oh, okay. So they affect the immune cells and the immune cells destroy them.
So you
soldiers destroy soldiers.
So you reduce the number of those immune cells reduces. You need to keep a good state of mind.
Okay. So we are now moving to the immune boosters.
Yes.
Okay.
So you need to avoid stress. I mean, you need to eat well. Fear, panic, anxiety, prolonged harboring of anger. All these are good.
Prolonged harboring of anger.
Yeah. All these are good immunosuppressants.
Okay.
You become immunodeficient.
Anger suppresses immune system.
Yes.
Severely. The Bible says, "Do not let the sun go down on your anger." It's a therapeutic scripture.
Yes. so that is why, if for instance you as a physiologist, you are happy being a physiologist,
yes,
but the very day you are dissatisfied with your physiology, within 1 hour the stress it will generate in you can lead to immunodeficiency. So job satisfaction, being satisfied with what you are doing, being happy, being in a good state of mind is actually a good immune booster. There are a lot of concoctions and drugs that are in the market that people say they are immune boosters. You ask them of the mechanism. They should tell you the mechanism. Because if we say immune booster, meaning you have increased your barrier level as far as infection or infectious pathogens are concerned.
Okay.
So, for instance, if you look at the nose mask people are wearing during this COVID, they have boosted their innate immune system because they have improved on the barrier, the innate barrier to the infection. So it's the wearing of the nose mask is an immune booster. It's an innate immune booster. Bathing, taking your bath regularly, washing your hand regularly is also an immune booster. You don't necessarily need drugs.
So bathing is also an immune booster.
It's an immune booster because you are washing off the localized pathogen, so you are improving on the barrier. So it's also an immune booster. So when we go into the adaptive immune system, the one that we can see, that is where in the case of severe immunodeficiency, you have the medics, the doctors prescribing some licensed drugs that the mechanism of these drugs are known. That they stimulate the bone marrow to produce the cells of the immune system. It takes something like the granulocyte monocyte colony stimulating factor. Okay. You take something like this, you are boosting the production of the white blood cells. Okay. You take something like thrombopoietin, this is a cytokine that boosts the production of red blood cells. Okay. So erythropoietin,
Okay.
boosts the production of red blood cells,
Okay.
whilst thrombopoietin boosts the production of platelets. So this, the mechanism is well known. But for the herbal drugs, I'm not saying they are not good, but if they are tested and their mechanism is known, fine. But if not, you taking those drugs is rather putting you at risk of immunodeficiency, because you are going to put stress on your liver, which is essential to the immune system. So you accumulate a lot of toxic substances that will prevent your immune system from responding.
We go for a commercial break, after which you will talk about the natural immune boosters. So viewers, let's go for a commercial break, and when we come back, Doc will talk about the natural immune boosters.
Green Hill Stroke Rehabilitation Center is a rehab center located in Sakaman in Accra, Ghana. It is the first accredited stroke rehabilitation facility established in Ghana. Green Hill Stroke Rehabilitation Center seeks to provide a high-quality rehabilitation service to stroke survivors who are out of the intensive care and requiring rehabilitation to restore functional performance of activities of daily living. The rehabilitation team includes attending physician, neurologist, rehabilitation nurse, 24-hour service, physiotherapist, occupational therapist, speech and language therapist, dietitian, clinical psychologist. Aside the stroke treatment, we treat other diseases at the Green Hills Medical Center. Call Green Hills Stroke Rehabilitation Center now on 055 25 05 108 or 030 39 74 818.
Okay, viewers, welcome back from the commercial break. I'm talking to Dr. Mubarak, an immunologist in the University of Ghana Medical School, who is educating us about immunosuppression and how to boost our immune system up. So he was going to talk about the natural immunity, so natural immune booster. So Doc, you're welcome back. Yeah.
So as I mentioned that I wouldn't end the episode without talking about the natural immunosuppressants, rather, not immune boosters. You know, age. Age is a natural immune suppressant. So the two extreme age group, the very old and the very young, naturally your immune system is slow, naturally. And this is because, as I mentioned to you, that the immune system is made up of innate and adaptive. Adaptive simply means you have to adapt to your environment. And it is also called acquired immunity. That means you acquire it based on the exposure you have. So as you are growing, you are now being exposed to the environment. So you are now developing that immunity. So that's why in the younger age group, their immune system is not that strong. So therefore, when you expose them to a high load of pathogen, they will easily fall ill. And the elderly, because also as you age, you know, the capacity of the organs involved in the production of your immune cells also reduces. And the cells themselves, their ability to get activated also reduces. And this is genetically associated, which we wouldn't go much into that. So mostly the elderly depends on the memory cells they've generated from the younger age. So when they are now being exposed to a new strain of a pathogen, it becomes very dangerous. That's why you see this COVID, the fatality case is very high among the elderly, because this is a new strain and they haven't come in contact with this strain in their life, and their production capacity is also low. So that makes their immune system very low and cannot handle the virus effectively. But when you come to the middle age group, that our immune system is at its peak, where our innate immune system can hold the virus, whilst our adaptive immune system is gradually building up. So you can actually have the infection without manifesting with the symptoms. So in this state, it's called asymptomatic. You are in the asymptomatic state. So when you keep your immune system very well, you maintain all the hygiene they ask you to do, wearing of the nose mask and everything, your innate is intact, will be able to hold on to the virus for your adaptive to build and hold it. So you will never go down with this COVID-19. So basically, these are few examples of immunosuppressants and immune boosters, but there are more to that.
So the age bracket is also very important.
Very
so
important.
At a point in time, you are careful what you come in contact with.
Yeah.
Okay. So what about the vitamin C thing, which has caused orange price to shoot up?
Yeah, vitamins are relevant to the activation of the cells.
Okay.
Okay, vitamins are very relevant to the activation of the cells. So at this time, taking in food with a lot of vitamin is very important.
Okay.
Vitamin D, for instance, that one you don't need to buy it.
Sunshine.
Although you can get it from food, but some 30-minute bout of sunshine is enough.
So you will rely in sunshine?
No.
Tan ourselves?
No.
You already tan.
Yes, you don't need to lie in sunshine. As you walk through, within 30 minutes is enough.
So the point is that we should get exposed to sunshine each day.
Each day is very important.
Okay.
If we can.
Okay.
If we can. Okay. It's very important.
So this claim for immune boosters, it's very key that we know whether it actually boosts our immune system or not.
And then you go by the natural immune boosters. Good state of mind, exercising to burn out fat that may prevent the signaling molecule from getting to the cells. These are good immune boosters, nothing else. And trust me, if you have problem with your state of mind, no matter the kind of immune boosters you take, it will not boost your immune system.
So fear, because I've heard few people who have recovered from the COVID-19 saying that don't be afraid when they get it. I mean, force yourself. I mean, they hype themselves, and I think they are able to recover. I think it's coming from that psychological effect.
Very important.
Okay.
So at this time points, you need psychologists also on board.
Okay.
To actually psych the people, let them know it's not a death sentence. I mean, it's just like a normal infection. That is all. But it's just because it's new to your immune system, that is why it is behaving that way. But as long as you keep your immune system intact, your immune system will hold it and develop memory against it, and it will not harm you in any way.
Great. So fear not. As summary, what's the advice can you give to the listeners before we sum up?
Right. So as we've mentioned earlier on, that we should all go by the natural immune boosters and keep ourselves healthy so that we don't go down with this COVID-19. People should know that the virus, having COVID-19, is not a death sentence. It's not a death sentence at all. So the COVID-19, the virus does not have impact in you than your own fear and anxiety. That is what will rather kill you, because to suppress your immune system and allow the virus to destroy you. And as I also mentioned at this time, the social distancing, you do so to prevent an infection. So you are improving your barrier. Is also an immune booster. Regular washing of the hands, you are doing so to prevent an infection. So it's also an innate immune booster. What we wear, the nose mask, is all an immune booster. So I encourage the viewers should follow this directive, and we will all be safe.
Yes, okay, viewers. So you have heard it all from Dr. Mubarak, immunologist in the Department of Pathology, University of Ghana Medical School, talking to us about immunosuppression and immune boosting. Immunosuppression is what you do, or the factors that brings down your immunity, which prevent your body from fighting against the COVID infection, which make you susceptible to the infection and not able to possibly recover or recover quickly. Immune boosters are the things that happen to increase the barrier to the infection, and also try to increase the level of your immune system, the factors in your body to fight against this virus. So you talk about fear, which is immunosuppressant. You talk about not taking a lot of NSAIDs or drugs that we call them painkillers and so forth. So we need some amount of sunshine, and we also need some amount of vitamin C. They all help us to fight this infection. So what I would say in a nutshell is this: let's keep safe. Let's avoid things that will immunosuppress us: fear, anxiety, rumor, wrong, falsehood. And let's do things that will boost our immune system, so that in case accidentally we come in contact with the virus, our body will be able to fight this. Till we come your way again, stay safe and keep social distancing. Fear not, and the Lord will be with you. Thank you.